One of the abstracts was presented by Dr. DeWeese. Very exciting. The first completed phase 3 oncolytic viral therapy in localized prostate cancer, looking at predominantly in the intermediate and high-risk disease space, using this novel agent that's injected into the prostate over 3 injections. And they compared it against a placebo, so it was randomized and double-blind. And they showed there was a 30% relative reduction in disease-free survival. Interestingly, their disease-free survival is defined by absence of local, regional, distant failure or death. They also did a 2-year post-treatment prostate biopsy, and if the biopsy result was positive, that was counted as a local failure. This is not commonly done in phase 3 trials, so huge credit to the investigators for performing this. But while local failure is prognostic, certainly, and we want to avoid it because salvage treatment carries extra toxicity. Local failure itself is not a surrogate for overall survival. So we're still waiting, for long-term follow-up with this trial to see what the long-term benefits are. For the STAMPEDE study that was presented by Dr. James, very exciting as it looks into whether a digital pathology-based biomarker can be used to select which patients would derive the greatest benefit from treatment intensification using abiraterone. And they showed that when you have patients with a higher score that's called MMAI, multimodal artificial intelligence, that those are the patients that derived a bigger benefit. Of course, one thing that has remained to be seen is that STAMPEDE very high-risk patients are higher risk than today's very high-risk patients because now we use PSMA PET to stage. So it remains to be seen how this plays out in today's environment.